Hey, Jamie.
Hi, Dedra. How you doing?
I have my sports physical today.
Okay, same address and phone number?
Absolutely, have not moved.
Okay, you can fill out the front of this questionnaire for me. We started a new program in the office.
What's this about?
It's about drug and alcohol use.
Okay, all right, I'll fill it out.
All right, thank you.
Here you go, Jeannie.
Okay, thanks. You can have a seat.
Okay, thanks.
Thanks.
For a woman, 7 and above is a positive. The last 3 questions is about drugs. She also said the drug which she does frequently is weed, which is also positive. So when we take the patient back to do the vital signs, we would ask them to do the back side of this form. When they're completed, we would give it to the doctor stating this patient is a positive and that they would have to go over the form with the patient, hoping to help them with the drug and alcohol problem that they have.
Hi, Dedra. How are you?
Hey, Bobby.
You look pretty today.
Thank you.
Come on with me, darling.
Okay.
How's your mom and dad doing, Dedra?
They're good. They're
And
good.
how's school?
It's a little rough right now. There's a lot going on.
Good. Okay, have a seat up there. Your weight's good. All right, dear. Are you taking any medicines right now?
No.
Are you allergic to any?
No.
Smoke?
Yeah.
You're smoking?
Yeah.
Okay, when did you start that?
It's been about, I would say, like a year now.
Okay, and you're 18, correct?
I am.
18, wow. All right, sweetie, let's go to the other room. Okay, I noticed you filled out the front of the form. I appreciate it.
Yeah.
Could you fill out the back too?
Yeah, no problem.
Alrighty, here you go. Have a seat. The doctor will be in shortly.
Hey, thanks, Bobby.
Nice seeing you, dear.
All right.
Marlene, this is Dedra. She's a nice young lady. She's been coming to the practice for a long time. And she scored an 11 on the alcohol part, and she marked down weed. So I'm kind of concerned because it's not in her character to be like this. So maybe you can help her, talk to her. Okay?
What's her age, Bob?
She's 18.
Hi.
Hi.
Dedra?
Hi, yeah, I need you. Yeah.
My name's Marlene.
Oh, nice to meet you.
Nice meeting you also. I'm the healthcare educator, and I just come in and I go over different information with our patients related to health. We tend to look at the whole health picture of our patients, and I think Jeannie had you complete this morning our health assessment form.
Yeah.
Okay. I was just wondering if I could take a few minutes to go over that with you.
Yeah.
But before we get started, I just wanted to find out what's going on with you today, how things are going, and what you're here for.
Well, this is a sports physical. I play basketball at my high school.
Oh, a jock.
Yeah.
Let me just start by asking you, because I want to make sure that we're on the same page. Do you know what a standard drink is? Standard drink, okay, based on the way that the government they've done tons of research and given us some really good guidelines. Yeah. But a standard drink is what's considered a beer, a 12-ounce beer, okay?
Just one?
Or a single shot of spirits, or a glass of wine, about 5 ounces, or a small glass of liqueur. Now, based on what I've described as a standard drink, is that about how you would define it?
Yeah.
Okay, and that's pretty much the standard that you use when you're answering the questions?
Yeah.
Okay. Now, what you've indicated here is generally you may have some alcoholic beverages about 2 to 3 times a week?
Yes. That's about right.
Is that usually during the week, or is that on the weekend?
I would say it starts on about Thursday and then till like Saturday.
And is that during a social activity, or are you at home drinking by yourself, or?
Well, this like we have parties a lot, you know, in the evenings after, you know, around like 11, 12 o'clock, people get together at somebody's house, and sometimes it's just a gathering, but so we always drink there, but, you know, so I go to those about, you know, 2 or 3 of those a week. Yeah.
Okay, so the government's done tons of research, and I just wanted to share some of the information that we've gathered from the research. We have what's considered information about low-risk drinking, and for folks like myself and you, for women, low-risk drinking is about 1 to 2 drinks on any given day, not to exceed a total of 7 in a week. Based on the way that you scored, you fell right in this area here, your score of 11. Okay, and that placed you in the high-risk drinkers category. And so what I'm seeing is that that 5 to 6 is quite a bit more. It's almost double, a little more than double what we consider standard drinks, low risk drinking.
I didn't realize that that was the standard. That 1 to 2 is the standard for women. So, yeah.
Just one other thing that I wanted to go over with you, and that was you'd indicated here that you sometimes smoke marijuana. Now, is that something that you do on a regular basis, or?
It's kind of the same thing as the alcohol. Like, I used to do it, once in a blue moon with friends. But since my boyfriend's name is Ian, since he and I aren't together, there's like this, there's groups. And I'm no longer a part of the group that I was with when we were together. So, and I guess in a way to make myself feel like I'm fitting in, then I'll go and I'll smoke some more with some of, my other friends. And so everybody wants to feel a part of something, so.
Okay. So when I think about an athlete and the effects that marijuana can have, I mean, that's something that you have to be able to react to very quickly. I mean, you're constantly going up and down the court.
Yeah.
So marijuana can actually affect that as well. And there have been a lot of studies about its potential for addiction. I'm not sure if you've gotten a lot of education about it in school, but it's a gateway drug. Okay, do you think you might give some consideration to just cutting back just a little bit to work towards not having those mornings where you're getting up late or feeling groggy?
Yeah.
Okay. And well, let's think about it like this. If we had a scale, say from 1 to 10, with 1 being not very confident and 10 being very confident, if you looked at that scale, where would you rate yourself on your ability to have some confidence that you might want to give some consideration to stopping the alcohol use?
I'd give myself, I would say an 8.
An 8 means 80%. You're 80% sure or confident that you can make a change. And that's wonderful. So let's focus on at least cutting back 1 to 2 drinks, if at all possible, and stay within that 2 to 3. And even if you could cut out one of those 2 to 3 days, that would be fantastic. Okay. Dr. Bilock is just now finishing up with one of her patients. I'm going to have her let her know that we've completed this education piece. And I'm going to wish you the best luck with your practice. And I really appreciate you just having the patience with me and letting me give my little spiel here.
No, it was really, really nice to meet you. Like, you made me feel very comfortable. So thank you.
Thanks. Okay. Doctor will be in just a few minutes.
Okay.
Hi, Dr. Bilock. Your next patient is ready. It's Dedra. She's an 18-year-old female. She screened positive for marijuana and alcohol use. She was really very receptive to the brief intervention. I think it would still be helpful if you gave her just a little reinforcement.
Okay.
Okay.
All right. Thank you.
You're welcome.
Hi, Dedra.
Hi, Dr. Felicia.
Nice to see you again.
Yeah.
You're here for your physical?
Uh-huh.
Okay, why don't you pop on the table and let's do the exam.
All right.
I was just a little concerned about the yellow form that you filled out.
Yeah.
You had already talked to
Marlene,
the health specialist. You're a pretty smart girl, and I think you would like to continue with your sports and have other
absolutely.
things going on for your life, but this amount of alcohol and using weight, that can affect your future.
Yeah.
Okay. You know that when you take alcohol, it can be very dangerous to you, and it can affect you in very bad ways. For example, you can get confused, you can be in positions that you don't want to be, it can affect your liver, your blood pressure, and you can even fall and injure your wrist or your ankle.
We are not talking about injuries. I'm a basketball player. Please, no. I'm really going to make a commitment to not do it because I can't even fathom being injured. Ugh.
Why don't we give a try of the plans that you've already said to substitute, cut down on the friends, cut down on your parties. You don't want your brother to be in a situation like this. And, it could have been worse, but, you're walking in a better direction now.
Absolutely.
Okay? So keep going to your practice, and I would like to see you back in about 3 to 4 weeks. When will you like to come back?
I would say like 4 weeks.
4 weeks.
Because I want to make sure that, we'll be into, practice a lot, and I want to make sure I'm ready before the season starts. So,
you come back, and I just want to check on you. You've been my patient for a long time, and I want to see you be on the right track.
Since I was this big.
Yeah. Okay.
Okay.
All right.
All right. Thank you, Dr.
You're
Felicia.
welcome.